So yay, we're finally in chapter 12. I know chapter 11 took forever. So we're going to talk about patient safety now. So let's first talk about how to prevent falls. So there's a couple key things I want to talk about here. So if you have patients who have orthostatic hypotension, this means that when they sit up or stand up, their blood pressure just plummets. It drops and they get dizzy and they're definitely at high risk for falling. So if you have a patient who has orthostatic hypotension, you really want to advise them to get up slowly, like sit on the side of the bed first and sit there for a couple minutes and then slowly stand up and wait there for a second before they start walking. So they shouldn't just like pop out of bed and start walking because they're going to go down. So that's an important thing for patients with orthostatic hypotension. We also want to provide our patients with regular toileting for those that require assistance. So if you have a patient and you just that needs assistance with toileting and you're not like providing that regular schedule for them and you're not checking on them frequently, they're going to try to get up and use the bathroom without assistance, and then they're going to potentially fall. So you definitely want to keep these patients on a toileting schedule. So you're taking them to the bathroom regularly so they don't feel the need to just pop up unaccompanied and potentially fall. So that's a really important one to know for ATI. Regular toileting schedule help prevent falls. We want to provide our patients with skid-proof socks. If patients are at risk for falls, it's best if we can place them in a room that is near, closer to the nurse's station so we can get there more quickly when that bed alarm goes off. We want to round on our patients hourly. We want to make sure that frequently used items are within reach, because if they're like across the room, then that patient will try to get up to get that stuff and may fall. So just make sure everything they need is close by and at hand. You always want to position the bed in the lowest position, lock the brakes, and set the bed alarm. So, and one other super important thing for ATI. You do not want to put up all 4 side rails for the patients who will try to get out of bed on their own. Okay. You definitely want to leave at least one side down. You don't want them all up, because if they're all up and if they're going to try to get out of bed on their own, then they're going to try to crawl over the rail and then they're definitely going to fall and they're probably going to hit their head and you're going to have to do an incident report. You're going to have to take them to CAT scan. And they're potentially going to really get hurt, first of all, of course. But aside from all that, you're going to have all this additional stuff, which is not fun. So always keep the side rail, at least one side rail down for those patients who are going to try to get out of bed on their own. Okay, so now let's talk about seizures. So it's really important to know what proper nursing actions are during seizures and after seizures. So during seizures, you want to lower the patient to the floor or to the bed, depending on where they are, and turn the patient onto their side. Super important to know. You want to loosen any restrictive clothing on the patient. You do not want to restrain the patient or put anything in their mouth, like a tongue blade, or try to put an airway in their mouth. So you will definitely get this question with ATI and NCLEX. Lower them down, place them on their side, nothing in the mouth. You want to note the onset and the duration of the seizure. And then after the seizure, you want to take the patient's vital signs, perform neurological checks, help reorient the patient, identify what a possible trigger was for the seizure, and then implement seizure precautions for the patient. So this includes padding their bed rails. So that is seizures. And now let's talk about restraints. So there are several different types of restraints. So we have like physical restraints, such as like a vest, a belt, or mittens. Or we can have chemical restraints, such as sedative or antipsychotic medications. Before you restrain a patient, you always want to try alternatives. So this includes reorienting the patient, supervising the patient with like a constant observer, or, we call it a sitter, but a constant observer is the official name for a sitter, or give the patient some kind of diversion. So reorient, supervise them, try to divert them. if those things do not work and you need to administer restraints, there are some key things you need to know. So in an emergency, an RN can place a patient in restraints, but they must get a prescription from the doctor like as soon as possible, likely within 1 hour, depending on your facility's guidelines. Orders can be written for up to 4 hours for adults. It's really important that we remove restraints one at a time, every 2 hours, at least every 2 hours, to assess for skin integrity, to do neurovascular checks, and to provide some range of motion exercises for the patient. So that's really important to know, at least every 2 hours. You should always use the least restrictive restraint to correct the problem. So mittens are typically the least restrictive restraint. They don't always work. Somehow they might sometimes get their hands out of those mittens, but if you can get by with mittens, you want to do that because that is less restrictive than doing like a wrist restraint to the bed. You want to apply restraints so that 2 fingers can fit between the restraint and the patient, and you always want to use a quick release knot. So you don't want to use a square knot or any other kind of knot. It has to be a quick release knot. And that's something that ATI will try to trick you up on. So make sure you know it's a quick release knot. And let's stop here. We'll pick it up with just the end of chapter 12 in my next video, and then we'll move on to chapter 13. Thanks.